day, and we pray for you that as you come in, let us work together as healthcare workers. Thank you.
Thank you so much, George. Now, I would wish to welcome Kerry, who will take care of all the remaining cadres, including the physiotherapists, the occupational therapists, orthopedics, social workers, and the HRIOs in the house. Thank you.
Thank you very much. Our governor, all protocols observed, members of the health profession. Bwana Yesu asifiwe. Timu Wanyonyi? Timu Wanyonyi? Bwana Governor, before I say what I want to say, I want to assure you ya kwamba kura yetu inakuwa kwako. And from my previous research, I can assure you that people ambao walidharau county health workers wakatuchukua kama sisi ni pupu. Hawakusikiza ile maneno tulikuwa nasema. Today they are not in the office. Who sent them home? We have influence where we come from. We are professionals. We come from villages where we have influence. When we talk to people, they hear us. Kwa hivyo, I would want to encourage you ya kwamba take these people seriously and do that which that they desire, and the office will be yours. Otherwise, I've been called to say a few things, and I want to start with the very basic that touches you and that you know very well. Aspects of disability, aspects of people with disability. Mambo ya disability in this country and in this county are taken to be a by the way. But if you look at the emerging trends in the world today, disability is not something you can do away with. It's either you are waiting for it or it's with you. And that's why we say today, nothing for us without us. Si kweli? In the health sector, like any other sector, disability is also taken as a byway. And I've looked at the Disability Act 2025. I've looked at the what we are calling the National Health Disability and Rehabilitative Strategy 2022 to 2026. And the key aspect that it speaks about, number one, it talks about inclusion of aspects of disability in all sectors of health, beginning from the level 1 to all the referral hospitals. Now, when I come to Bungoma County, I realize we have serious gaps. Number one, the first gap that we are having is in the infrastructure. Our infrastructure is not friendly, not only to persons with disabilities, but even to the normal-bodied people. You look at Bungoma County Referral Hospital, for example, and you walk there, you go to the areas where our clinicians are seeing patients. There's no privacy. Kama umekuwa pale. Si ni kweli? Hakuna privacy. Daktari anakaa hapa, mwingine anakaa hapa na mgonjwa, mmoja anakaa hapa na mgonjwa. There are no ramps. There are no toilets that are disability friendly. Our infrastructure in this county is wanting. Not only for persons with disabilities, but generally, mahali ambapo madaktari hapa wanafanyia kazi jamani, si mahali mzuri. Tungependa, unapoingia kwa ofisi, kwa sababu tuna uhakika ya kwamba unaingia kwa ofisi, hiyo maneno uangalie vizuri sana. Number 2, it is in terms of representation. If you look at, if you look at the number of rehabilitative workers, even represented here, ukihesabu utaona mikono ni michache sana. Why? We are only found majorly at the level 5, level 6, and a few sub-county hospitals. Sijajitetea, nimetetea kila mtu. Si ni kweli? Kwa hivyo ukiita watu kutoka sub-county wakuje, health workers for example, wakuje mahali, utapata the key component and the key rehabilitative, health workers that will be lacking. Watakuwa ni rehabilitative workers ambao wanastahili wasaidie mtu akivunjika pale on the ground. Tufanye prevention, tufanye treatment, ili kwamba tupunguze maneno ya ulemavu katika kaunti yetu na katika nchi hii. Kwa hivyo naomba unapoingia ofisi, jamani, tuangalie the numbers of rehabilitative workers, tuangalie the infrastructure. That will be very important. Ukifanya hivyo, sisi tutakuwa tunapiga magoti yetu tukikuombea ya kwamba uishi milele. Uishi milele, hiyo itakuwa muhimu sana. Number 3, the government demands ya kwamba everyone in this country akuwe identified na daktari kuwa mlemavu. Kuna kitu tunaita disability assessment and registration. The mandate of health workers ni 2. Number 1 is to assess disability. Whether we are seeing it or not, we are supposed to do assessment of disability na tuandike report. Na mtu anapotembea na hiyo report, anapoenda mahali popote, anakuwa identified and verified kama mlemavu. Hiyo ni mandate yetu ya kwanza. Mandate ya pili, kuna kitu ambayo inaitwa kwa tax exemption, kuna kitu inaitwa, of course, is verification. When people are going for tax exemption, health workers must be there, ambao wataverify kwamba ile maneno aliandikiwa down there ni ukweli na kabisa huyu mtu ako na ulemavu. Kwa sababu kuna mambo ya ulemavu ambayo hayaonekani, mtu hawezi kuyaona, yako ndani kabisa. Kwa hivyo, in this county, we have a problem when it comes to aspects of assessment of disabilities. It's only done in a few hospitals, number 1, and number 2, these days it is free. And because it is free according to the Disability Act, it demands ya kwamba watu wakae kama team, kulingana na policy, wakae kama team wafanye disability assessment. Now, itakuwa vigumu kukalisha madaktari kuanzia asubuhi mpaka jioni, hata maji peke yake ya kukunywa hawawezi nunuliwa na hospitali, kwa sababu ile kitu wanafanya haigenerate income. Tunaomba ya kwamba unapoingia kwa ofisi, because it demands a team, hiyo maneno tuangalie, tuone how can those teams be strengthened, how can they be facilitated, how can they be motivated, ili kwamba wanapokaa na kusaidia watu wetu, because these are our people and it include all of us, ya kwamba hawa watu wakaweze kusaidika, na itakuwa muhimu sana. Finally, tunaomba ya kwamba maneno ya physical spaces na infrastructure pia uangalie. I think I had touched that, na itakuwa muhimu sana. Otherwise, thank you so much. I hope I've been very brief, and I know our governor unaingia kwa ofisi kwa jina la Baba, la Mwana na Roho Mtakatifu. Sema amen. Asante.
Thank you. He comes. Felicitas should be preparing.
Thank you. Your Excellency, and all protocols observed. Once more, good morning. I'm here not to speak on behalf of the medical laboratory fraternity alone, but on behalf of all these medical officers, healthcare workers. Your Excellency, we've been having a series of problems when it comes to promotions. That one I can attest. Someone can overstay in the same job group, like for more than 7 years. But when it comes to promotion, that officer is just promoted to the next job group. But ideally, that person is supposed to have been moved at least 2 or 3 tiers ahead. So we strongly believe that with your government, you are going to take into consideration on the fact of promotion, so that at the end of that period when this officer is supposed to be promoted as per their career development guideline, let them get the promotion letters. Kindly, we humbly request that you be our ambassador and you be our chief campaigner, we as unionists, by promoting promptly these employers of ours, so that we have very little to explain to ourselves why we deserve to continue being in office, because you have delivered on our behalf. Your Excellency, when you look at the policies being made by the county government right now, it will inform you that you have a problem with a shortage of personnel. That's why the so-called lockdown policy is being formulated. Once you enter into the office, my humble prayer is trash that lockdown policy far much away and employ officers on a permanent and a pensionable basis. Because through such a kind of an employment, that's when an officer can be able to develop himself or herself. But when you give someone a locum of 2 days, 3 days, honestly speaking, that will be disservice. And you know very well, Your Excellency, sir, that with healthcare workers in this country, once we have a healthy nation, a healthy county, development will trickle in like no man's business. Lastly, I want to assure you that all these teams seated, all these officers seated here, they are ready to deliver and see you as the governor come 2027. And if in doubt, you can ask my brother Jesse. He has the history. May God bless you as you forge forward to be our next governor come next year, August. Thank you very much.
Thank you. Thank you so much, Nabeki. Felicitas?
Mheshimiwa wetu, tunasema asante kwa ajili ya nafasi hii. Nitaenda tu direct kwa point. Ya kwanza, Mheshimiwa, tunakuomba. Sisi kama CHP, sisi ndio level 1 kwa community. Lakini hatuna barua ya kuthibitisha ya kwamba sisi ni madaktari mashinani. La pili, stipend yetu yenye tuliagizwa ya kwamba tutakuwa tunapewa. National huwa inafanya vizuri, lakini county governor anatupea kwa wakati ambao mwenyewe amejisikia. For example, last year, the whole of last year, ametupea miezi ya nyuma 4 na ya nyuma 4 tena hajatupea. Sasa kumaanisha ya kwamba hiyo imeisha hivyo. La tatu, tulipewa simu za kutumika ECC. Tunafanya mambo na online. Lakini mara mingi huwa hazifanyi, zina hang. Ukiingia kwa household, haiwezi kufanya. Sasa inapatikana ya kwamba hatufanyi kazi vizuri kwa ground. Alafu la mwisho, tunakuomba Mheshimiwa. Tumekuwa na wafadhili kama Amani ambao wamekuwa wakitusaidia wamama wajawazito kupeleka hospitali kujifungua. Lakini Amani ilipoisha, siku hizi hata unapata wamama wengi wanajifungulia nyumbani na tunapata watoto wengi wanakufa kwa ajili ya kutokufika hospitali mapema. Tunakuomba unapoingia huko, bali ningesa hata Mheshimiwa. Kukusaba kumanyira kuli woli nende bandu bakali ni bonyara wache wakusabirako. Usabireko malafu esikolane kuba na kunyola. Bafadhili abao beche bakuyete. Ili wamama wetu wajifungue katika njia inayostahili. La mwisho, katika dispensary zetu, hawajakuzia lakini katika dispensary zetu tunaomba ya kwamba hatuna choo za disabilities. Tunakuomba iwapo utaingia, na tuna imani ya kwamba unaenda kuingia, utatusaidia pia zikue choo za manufaa. Asanteni sana na tunakuombea na tuna imani unapita.
Thank you. Asante sana Felicitas. And that brings me to the end of the speakers, Your Excellency. The issues they have raised are largely on service quality, issues of infrastructure and equipments at the facility level. Health systems financing has strongly come out from the issues they have shared. And finally, HRH issues seems to be the lion in the house. Sindio? So, all these issues are also contained in a document that was able to be compiled through the team and is available for reference as well. And I believe we will continue to engage and even share more as we move on, so that as we look forward to 2027, and we really believe that our governor is going to be Mheshimiwa Tim Wanyonyi, all this shall be brought to an end and health will really thrive in this county. So to that extent, I would wish to take it back to the campaign manager for the next level. Thank you.
Tushangilie hao wote, tushangilie sana. Asante sana. I told you, Mheshimiwa listens, isn't it? He listens. The only thing I do is to document it. All that you have said has been documented. And when Mheshimiwa develops his manifesto, you can be sure these issues are going to occupy about 35% of the document. So that is done. Without further ado, we are running late because Mheshimiwa is going far, to some other engagements. I would like to call upon... You're okay? You're okay. Okay, good. So, ladies and gentlemen, without further ado, the governor, 2027, the governor Bungoma has been waiting for. The governor will bring change.
Aya, asante sana. Asante. Thank you very much. Good morning. Good morning. Happy New Year. Bwana asifiwe. Asalamu alaikum. Mlembe mwezi. Mlembe swa. Mlembe te. Asante. Muhammad Nyileta, my name is Tim Wanyonyi, currently serving as a Member of Parliament for Westlands constituency in Nairobi County. I'm serving my third term in that constituency. I've been elected 3 times consecutively. But now I'm in Bungoma. I've come home. Now we are home. And I want to serve you, if you allow me. I want to work for you the way I've worked for others out there. I know issues of health sector in this country is one of the sector that has been mishandled, mismanaged, and you have actually, our health sector is one of the worst. You know, even in terms of resources dispersed in the sector. There are always people arguing over it. There are always issues with the Ministry of Health. The ministers go there, they are fired, they go. But sometimes we don't solve the problem. When health was devolved, some of us thought it was a mistake. Health should have worked the way it was before. Yeah? When we had those local government, at the lowest primary level is where health was left to the local government. But the mainstream health, the upper sector, was for the national government. And that's well over. But when we devolved, and then we did devolve certain functions from the national government, they remain at the ministry, they remain at the national government. So you find even some doctors are reluctant to be employed by the county government. They want to remain on the payroll of the national government. That is there. The other thing you have talked here, I've listened more. And since I'm still developing my manifesto, and I know health is one of our pillars, we will want your serious input so that we capture your issues, and when we come to address the health matters, we'll know we'll be dealing with the right information that you have given us. And I can assure you, when I see there anything that will come through to the county government that belongs to the health sector will be directed to the right place. No divert. I know many times we divert resources because maybe some other sector is more urgent than others. There's no sector that is more urgent than the health sector. There's no sector. Not even education. I think health should always come first. Sindio? Because if you are not well, you can't do anything. If you are not well, huwezi hata kula. So we must always look at that. How do we manage our health sector properly? If you go to other countries, for example, a country like Sri Lanka, Cuba, and other these Asian countries, that's why we see our people trooping in India, wapi wanaenda kufanyiwa matibabu. Because they have invested in their health sector very well. And I don't know why we cannot do that. I think one day we'll get it right. But that is my take on that. Secondly, all health sectors that I've listened to here, the policy issues, the law, especially the law on dealing with issues of disability. My brother here has dwelled so much on disability issues. Disability issues, accessibility is a constitutional issue. And if you go to the US, it is just cited as a discrimination. If you are not compliant, it is a discrimination and it becomes a constitutional issue. And if you are cited for constitutional violation, the law will take its course. Here, even that issue of accessibility, the national government is exempted from it. You cannot sue the national government because they have not implemented a section in the Persons with Disabilities Act. And that's something that we'll work on, make sure that all sectors comply with the law, that people must be given their rightful place where they belong. The other thing that we need to address is, I know I'm a consumer of some of the health services, almost on a daily basis. My physios are here. Yes, that is a sector that I belong to almost. I subscribe to them almost every day. There are sectors like the CHBs. The CHBs, I know what they do. I've worked with them in Nairobi. I've engaged them briefly here, but we'll be engaging more and more. And these other sectors. So that we listen to these issues. You know, there's some tokenism that is being given to them, and it comes not quite often. I think when the governor is happy, then he releases the money. When it's not, the money is not there. Sindio? It should just be made known that you are expecting, if it is 5,000 every month, you get it. Sio unaipata after 6 months. Sio unaipata kama vile the governor's mood, how is swinging this way or that way. So we must always listen and do that. All other sectors, the nurses, the doctors, and other sectors in the health sector. Me, I'm ready to work with you, and I'll be there for you. And I can assure you, always the park will stop at my desk. If the people I've given assignment are failing, just come to me. And I can tell you, your union, those union representatives, always be on top of things, because I've seen some unions when the national government becomes uncomfortable with what you are doing, then you retreat. A union, I know there are people who are fearless. They never stop articulating issues affecting their clients. Those are the unions that we want to see. If you are allowed to take the government to task, then do it without fear. Do it without fear. Don't retreat because somebody has called you and threatened you. You know, if that happens, then you are not made of that stuff of representing people. We must go out there, listen, and do the right thing. And if you step forward as a unionist, you must always remain a unionist. Sindio? We have had unionists who have risen and become presidents of countries. So you know, Sami Nujoma, he became a president, he was a unionist. Lech Walesa of Poland, he became a president, he was a unionist. And we have had fearless unionists in this country who have spoken and who have represented people very well. So we want the health sector to be put in the right place that it belongs. I've sat in committees in Parliament where procurement of the health sector is done by the national government. These equipments are sent to hospitals in the counties. Sometimes those equipments are just lying there because maybe where they have sent them, there was nobody who was qualified to operate those machines. And on like that. That just means we have our priorities wrong. So as moving forward, let us engage more. Let me hear more from you. Let us have your input in our planning, in our policy issues, so that when we are planning to now take over the county government, we will be doing the right thing. And you can hold us to account when we are in the office. So, that is all what matters. The rest of the things are just details. I just want to assure you that during my time, and I know you'll elect me, when I'm in that office, I will give you the services that you need. I will listen to your concerns. If I don't have the capacity to do it, I'll take it to the right place where they're supposed to address them. Sindio? But always look at the law. What is the law saying about the health sector, a particular health sector? And many times, people are uncomfortable going to be treated in our public hospitals because they know the problem that is there. They know very well. You know, in the US, the president of the United States, if he's sick, he can only be treated in the public hospital. And those public hospitals are military hospitals. That's where they know the security of the president is guaranteed and he will be given the right medication. Not in the private sector. However well-equipped the private sector is, the security is not guaranteed. So, even here, we must go to that direction, that we invest more and better in our health sector. Why don't we have even rehabilitation facilities at every level of our counties? We need them. And there are people who are suffering and they need to go through those processes. People travel from here, they go to Nairobi just for dialysis. I'm Eldoret or wherever they go. Yet we can have it here. We have our hospitals level what? Level 5 or 6. This referral of Bungoma. It should have those facilities. That hospital, we've been hearing debate on about they are coming to invest into level 6 hospital here, and there's a very, very serious debate of where it should be placed. For me, that is not an issue. Whether it's placed in the Kopsiro, whether it's in Tongareni, whether it's in Sangalo or wherever, as long as it's in Bungoma County, it will serve the interests of the people of Bungoma. It's not an issue where it will be, sindio? Walete pesa, wachenge hiyo hospitali, hauta travel to go to Eldoret. You will just go in Bungoma County and you will be treated and you will be taken care of. Sino kweli? Kwa hivyo watu waache siasa ndoko hii. Because we must always look where, if the money is coming, then fight for another facility. So that tuchenge hiyo, tutafute ingine tuweke mahali pengine, si ndio? Our universities here, Kibabi University, they should be having medical schools, they should be running medical schools. They should be having facilities that now even people will come and invest there more. Sometimes when you go out there in those countries where you go for treatment, the people who are treating you are students. You call those facilities are owned by university and owned like that. So if we have an open door policy and allow investment in our institutions, then we shall have services at our disposal. There was once I went to Poland and I went to see a health facility there, and they were talking about I think sports medicine or something like that, where they treat sportsmen, those who are injured on the field. Everything is managed there before you reach the hospital. So sometimes, even at the accident on the road, those so-called good Samaritan, they mismanage the patient at the scene of the accident. They aggravate the injury, so that you get to hospital, ile injury ingekuwa kidogo imeharibika sana. Sindio? Like me, where I was injured, I was taken to hospital on a top of a pickup. So you can imagine, by the time you arrive there, the pain and many other things have happened. So until we do that, if we have first aid done, everything done at the scene of the accident, then we minimize the complication that will arise from that. We have had midwives, those mamas who help women deliver. Sometimes nobody even understands how they do it. But they deliver babies, sindio? They do it very well. Sometimes we need to help them with just hygiene equipment so that they can manage those things properly. So all these and many other things that bedevils the health sector, we need to put our heads together. I'll listen to you, I'll work with you, and every step, let us make sure that we get it right from the onset. Let's not wait to start fixing issues after they have gone wrong. Sindio? And me, I want to be very frank with you. I'll be ready and willing to listen to you and also to do the right things that you have put in place. Sindio? Ile kama siwezi, nitakwambia. Lakini kama naweza, nitawaambia hii tunafanya. Yeah? The biggest problem we have in this country is implementation. That is where, in fact, we have very nice laws, very beautiful laws. But we don't implement. Look at traffic laws. It's one of the most chaotic things. Police, when they go on the road, they just want to look for money. Akikusimamisha na gari, hata kama hiyo gari imetoka kwa store mpya, lazima atapata makosa kwako. He will make sure lazima akule kitu. Sindio? So, sometimes if you know you are not wrong, don't accept this guy to intimidate you. And sometimes, those who refuse to compromise, are the ones who set precedents, that those precedents will help others. Sindio? If you go to court and they ask the court to interpret that law that is trying to charge you with, atapatikana huyu jamani mjinga sana. So that we don't just compromise because you want quick fixes. No. We must always refuse to compromise and insist that the right thing must be done. We have seen the health sector. Me, if it was my wish, the people in the health sector should be the last to go on the street protesting for their rights. Because you are an essential service. You cannot belong to the street. You belong somewhere that people need you at every critical time. Sindio? Sio kwa street, because there are people out there who are stubborn, they don't listen, and they just wish away things that have been agreed upon. These are the things that we must work on. And our generation today, we must fix Kenya. We must fix our counties. We must bring back what the people of Kenya desire and want to see. Sindio? Maybe when I was growing up, the health sector was good. We'll go to those dispensaries and we get medicine and you are treated, you go home. These days, those dispensaries, hazina dawa. What happened? Hakuna. So those are some of the things that we do. I've been seeing the county government wrestling with the national government about procurement and buying medicine, not from KEMSA. They are saying they can buy from other sectors. And I agree with them. Because KEMSA is given a monopoly and sometimes they are not giving the services that is needed. So if we have some other service provider, they should be given room also to do that, so that we get these things right down here. And we can get it right if we work smart. Sindio? If we work smart, then we can get it right. Ladies and gentlemen, thank you for your time, and thank you for coming. And let's engage more. Asante sana, Mungu awabariki.
Thank you. You have listened to a manager, isn't it? We are not just going to elect a politician, we are going to elect a manager. And what Bungoma needs right now to get us out of that hole is a manager. You are listening to you talked about legal issues. Mheshimiwa is a lawyer. And therefore, when you say that we need laws that work, you are in safe hands. He's a lawyer who will tackle the legal lacuna that is there. We'll bring it out. You are listening to a practitioner who will do all these things. Ladies and gentlemen, you are listening to a man of humility. If you talk about humility and want the definition of humility, humility is nothing other than Tim Wanyonyi. That is his definition of humility. So let us go that way. You are professionals. All people sitting here are professionals. I will not understand why a professional would not want to have a professional in office and go for some, yes. So please, if you are a professional, birds of the same feather flock together. Birds of the same feather flock together. You are professionals. You must be flocking with a professional. Here is the professional. If you are a quack, then please don't go to Wanyonyi. He's not a quack. So if you are a quack, yes, then go and elect somebody else who is a quack. Okay? But if you are a true professional as you are sitting here, then ladies and gentlemen, this is the professional, your person, a person who is like you. A person who will get the Kenyan people out. Without further ado, ladies and gentlemen, thank you very much for coming here. We are going to engage you as we go forward. As we develop our plans, we'll make sure that you are at the heart of those plan making. As we come to implementation, even developing the policies, working with the leadership, we're going to get a few of you to work with us to ensure that when you put in place our policy, that your input is captured in that. So from among you, we shall be working to identify a few who will sit with us and work on this. When we get the agenda, the manifesto developed, I would like to assure you that we are not going to sit down as what wa mkono wa Mheshimiwa Tim Wanyonyi alone and develop it. We are going to capture from you, a few of you, with sharp minds. And I've listened. I've seen sharp minds here. I will want to tap those sharp minds to develop the manifesto for Mheshimiwa Tim Wanyonyi. Are we ready for change? Are we ready, Bungoma, to get a governor that will move us forward? Are we ready for Team Fresh? Are we ready for Governor Fresh? That is none other than Tim Wanyonyi. Asante sana. Karibu sana next time. Now, as you leave, we'll just remain seated. We shall do some bit of consultation and then we shall give you the way forward. Sawa. Karibu tena Eninga. Eninga is that bird that has gone away to look and has now come back with goodies for us. Asante sana.
Wakati umefika. Wakati wa mabadiliko ya kweli. Bungoma inahitaji uongozi wa maono, uongozi wa hekima na uongozi wa mtu ambaye amethibitisha kazi yake kwa vitendo na sio maneno tu. Tim Wanyonyi, mwanaharakati wa haki na mtumishi wa wananchi kwa zaidi ya miaka 10. Tim Wanyonyi anarudi nyumbani, anaielewa Bungoma, anaijali Bungoma, na sasa yupo tayari kuitumikia Bungoma kama gavana mwaka wa 2027.